Hello, my name is Vicky Matthews, and we're going to talk today about the efficacy of natural family planning methods. We'll start off with a brief history of the method. It was mentioned in 388 AD by St. Augustine and was first documented by the Catholic Church in 1853. In 1905, Theodore van der Weyde demonstrated monthly ovulation. It was used in 1930 by John Smulders to establish the first rhythm method clinics. The 1930s saw the Reverend Hill develop the method and based it on basal body temperature. John Billings discovered the relationship between cervical mucus and fertility in the 1950s and set up teaching centres. The Couple-to-Couple League began to teach the symptothermal methods in 1971. 2 to 3% of couples worldwide use NFP as their method of contraception. The lactational amenorrhea method is thought to reduce the world's fertility by 30 to 45%. NFP is the third most common method used in Brazil. And in India, it is the most commonly used method alongside of condoms. The effectiveness of fertility awareness methods, as most contraceptive methods, can be assessed in two ways. There's the perfect use rate, which is where people who follow all the rules and abstain totally on fertile days. And then there is the actual or typical use rate, which covers everybody who uses the method. The effectiveness of the method is measured by Pearl Index and looks at the total number of months and cycles of exposure, the number of failures, and the reasons for leaving the study. Failure rates vary wildly depending on the method being studied, the instructors, and the population being studied. Rates from 25% to less than 1% have been cited, with most falling at around 2 to 3%. However, used correctly and consistently with ongoing support from the NFP, it has been shown to be more effective than 99%, the same as many other methods. Failure rates for individual methods. Post-ovulation methods is less than 1%. Symptothermal methods, 2%. Mucus only, 3%. And calendar only, 9%. The reasons for lower typical user effectiveness: conscious use and non-compliance, having unprotected sex on identified fertile days, mistakes from those providing the support and teaching, and mistakes on the part of the user not fully understanding the rules and charting. The most common reason for actual lower effectiveness is not mistakes from the instructors or users, but the conscious non-compliance of the individual. This compares to condom failure rates caused by non-use of that method. There are not many recent studies. A study was done in 1997, published in the Human Reproduction magazine by Dr. Petra Frank Herman, and showed fertility awareness methods to be just as effective as the contraceptive pill. In this, the largest prospective study of the symptothermal method, researchers found that if couples either abstained or used condoms during the fertile phase, the rate of unplanned pregnancies were 0.4 and 0.6% respectively. Out of the 900 women studied, 0.4% of them became pregnant. These women were part of a larger cohort of 1,600 women who were studied for 20 years from 1985 to 2005. These 900 women provided 1,763 cycles of data for this study. Dr. Frank Herman concluded, for a contraceptive method to be rated as highly effective as a hormonal method, there should be less than one pregnancy per 100 women per year of use. The pregnancy rate for symptothermal methods used correctly in this study was 0.4%, or one pregnancy per 250 women per year. So therefore, we maintain that the effectiveness of symptothermal methods is comparable to that of modern contraceptive methods, and as such is an acceptable and effective method of family planning. A similar study was done in Belgium by Dr. A. de Lezola Cordonnier, which covered 1,200 cycles, and 71 women reported a similar efficacy. The guru of contraception, Dr. John Gilbo, from the Margaret Pike Centre, says that an ideal method should be 100% safe, 100% effective, independent of sexual intercourse, effective after simple and acceptable procedures, reversible, cheap and easy to distribute, acceptable to all, used by or obvious to the woman who has the highest stakes in fertility, and it's useful for it to have beneficial side effects also. Clearly, that is idealistic and impossible, though NFP complies to most of those things. It's important to remember that we are working against nature here, and any method is a compromise. So let's look at the efficacy of other methods. Compared to NFP, most have side effects and associated health risks. There is only one healthy 100% method, and that's abstinence. The male condom is up to 98% effective when used consistently and correctly. The female condom, 95%. The combined oral contraceptive pill or progestogen-only pill, 99%. Depo-Provera injections, 99%. The cap and diaphragm, 92 to 96%. The vaginal ring, 99%. And the implant, 99%. A study in the USA in 1999 aimed to assess doctors' knowledge of NFP. 375 doctors who were seeing women on reproductive issues. Of those, 46% mentioned NFP. 22% of those thought that NFP was less than 90% effective, and 35% thought NFP was less than 70% effective. Those who gave the highest estimation of NFP efficacy were those who were aware of instructors in their community. Those who were not aware of instructors underestimated the efficacy of NFP and did not give out information on the method. So, get out there and spread the word.